Hey, this is Dr. Ben Pearl with FitFoot U. So I have Amsterdam in the background. I wish this was real and not a picture, but no, I'm in my office and this is a hanging picture in our lobby. What I'm going to talk today about is regenerative medicine and expectations, real expectations. So here we have a picture, not reality. And sometimes that's what you'll get when people talk to you about regenerative medicine options. The real deal is each individual case. Everybody's a little different. They bring different sets of things to the table. They have different compliance levels and protocols they follow after. So today I'm going to be talking about umbilical cord and possible options after an umbilical cord injection. I have the patient's own words, and you'll get the real deal on what the immediacy of the treatment was and 1 week after. Okay, we're 1 week status post an umbilical cord growth factor injection. We had previously done pulse electric magnetic fields, which had minimal effects for the 3 or so sessions. We did about 3, I would say. 3 or 4. And I'm going to let the patient, in his own words, kind of go through his initial pain level and then where he sits now with the fasciitis, which is mainly the heel. And this is the shape of the foot.
Yeah, so, well, the initial pain level upon injury was, could anywhere from like a 6 to 10, so it was pretty severe. I came home, I was on a trip when I injured it, came home for a few weeks, I just sort of let it try and heal on its own, and then the pain was getting between a 4 and a 6, but not really going away, so I decided to come see you. And then we did the various treatments, and then we got the growth factor shot a week ago on Wednesday.
It was 3 cc's.
And then Thursday, Friday, it was great. I thought, wow, this thing works pretty instantaneously. And so,
which I'm attributing, like I said, to the cytokines and the story.
And then over the weekend, probably by late Saturday, early Sunday, started feeling some mild pain again. Again, not excruciating, probably somewhere between a 1 and a 3. Off and on, there would be moments where I'd walk or stand and I'm fine, and other moments where I could feel it. And it's more around discomfort and slight pain, but not extreme pain, but clearly something that, is noticeable and I would like to have healed and not feel anymore. So that's kind of where we are right now.
And then how much walking have you been doing?
More so as the days have gone by since the shot.
Approximately.
Thursday, Friday, not much at all. I probably sat at home, sat at my desk working, and really limited myself.
And then over the weekend?
Over the weekends, a little bit more. My kids had soccer games,
sure,
that sort of thing. But I would walk slowly. I brought a chair with me to sit on, the whole game. So it wasn't like I was standing or running around. But walking to and from fields and parking lots and things like that. So the walking was a bit more over the weekend than it was on the Thursday and Friday. And then a little bit less walking, come yesterday.
And so no Cambu. We did do the silicone heel cup, and then you had the soccer games. You were wearing
I was wearing
the better
my sneakers with the full.
You had
the full
arch
insert,
support.
the arch support, the customized arch support, and
which type customized? Remind me. You got that at a running store?
Yeah, in store at one of the running stores.
The Curex, or
I think so.
Something like that.
Yeah, exactly. But stand on the machine at molds.
Yeah.
And then, I had the this thing and plus the.
Yeah, there's an offloader heel orthotic that I'm going to take a look at. I'm getting it shipped from a company called The Defender. They do it mainly for heel ulcers, but I'm going to look at it for this application potentially. So that's another thing that we could add. So we'll see where we are. We're contemplating whether we're going to add a focal shock wave, which we have not done. Obviously, the full healing cycle, like we said, is 6 weeks for the growth factor to really do its thing. So we'll sort of see where you are in about a week.
Okay.